This is a contrast and CT scan of a 48 years old male patient. Was a known case of periampullary carcinoma for which Whipple's procedure was carried out in 2017. Patient remained asymptomatic, but recently the patient has developed swelling and pain in the epigastrium. Now there is mild dilatation of intrahepatic biliary channels. Please trace it down. This is the site of confluence of both the hepatic ducts. This is common hepatic duct which is dilated. Please trace it down. Just see that this is opening into this dilated gut segment. This one. I trace it back up again. This is opening into this blind ending dilated small gut segment. Now this is the small gut segment which is distended. This lies just below the left lobe of liver and posterior to this contrast opacified jejunal segment. Partial gastrectomy and gastrojejunostomy has been done. Gastrojejunostomy, site of anastomosis, it's functioning normally. This is the site of anastomosis here. It is functioning normally. The orally administered contrast medium is passing down into the jejunum. Now this is the blind ending dilated obstructed small gut segment. Please see these valvulae conimentes. Now I trace it down. Please follow this. This one is the mass lesion here. This is a metastatic mass lesion which has obstructed the afferent limb of jejunum. Full stop. Now this mass has irregular outline, spiculated borders. It lies in contact with the anterior surface of right kidney. Its interface with the kidney is indistinct. The mass has involved inferior vena cava. Its lumen is markedly narrowed and is barely traceable here in this region. Now this is aorta. The mass has surrounded right renal vein. Its lumen is severely narrowed. The mass has also surrounded right renal artery. The mass has surrounded medial part of the left renal vein as well. Its lumen is also severely narrowed. Now I trace this mass down. The mass lies in contact with the aorta with indistinct interface. So this is the metastatic mass lesion which has involved the afferent limb of jejunum here, and this has resulted in the dilatation of the small gut segment which is ending blindly at this level posterior to the residual part of the remaining part of the stomach. Now I trace it down again. This is the region of the head of the pancreas. There is no recurrence of mass here. Calcifications, metallic clips here. Rest of the body and tail of pancreas, they are atrophic. Sub-centimeter sized lymph nodes are present in left para-aortic region, like this one here. Its maximum diameter was approximately 9.0 mm along its short axis. Although the size is small, but since there is a metastatic lesion here, so the chances or likelihood of these being metastatic coloration are all more. Now please observe this is the right kidney here. Since the mass has involved right renal vein and its lumen is markedly narrowed, and the lumen of inferior vena cava in this region is also almost obliterated, there is venous congestion, so there is increased density of the perinephric fat. Pararenal fascia is thickened. Please observe these collateral vascular channels lying along the pararenal fascia and in perinephric and pararenal spaces. These are the sequelae of the venous congestion because of the involvement of this mass and obliteration of the right renal vein. Now, similar increase in the density of left renal fat is also present. Perirenal fat is also present. This is also a sequelae of the venous congestion. Now I will show you the delayed scan. This is the delayed scan. Same findings. Dilated blind ending gestional segment, afferent loop. This is the site of obstruction here by the mass. Now this is the mass. Excretion of contrast medium is present, although delayed. There is no hydronephrosis. This is left ureter. Delay and poor excretion of contrast medium on right side. It is because of the vascular encasements by the metastatic mass lying anterior to the mid-polar region of right kidney. The rest of the abdomen is essentially normal.